Hello, everyone. I am Dr. Megan Davis. I am president of the Alpha chapter of Delta Omega. And I'd like to welcome everyone here. And we're going to start with a little exercise, a warm-up. I'd like everyone who traveled at least a block to be here to raise your hand. Great, great. This is not a keep your hands up, keep your hands up. Okay, now everyone who traveled from outside of Baltimore city limits, please keep your hands up. Fantastic. Okay, everyone who traveled from outside of Maryland to be here today, please keep your hands up. How about the East Coast of the United States? Keep your hands up. How about internationally? Keep your hands up. Oh, remarkable. So for those of you on the webinar, we actually have like almost a dozen people with their hands up. So that takes a great deal of commitment. And thank you for being here. So we're going to talk a lot about commitment today, commitment to our values of scholarship, leadership, and service. And today is a really special day for me. It's actually the 10th anniversary of my induction into Delta Omega. And it's been really remarkable to be part of this incredible organization. I've watched it not remain sort of static, you know, something you put on your CV, but I've watched it grow in the last 10 years. And we've brought in new people, new energy, new awards, and we're going to have some discussion of those in just a moment. And it really has been remarkable to see the directions we've gone in. For the first time today, we welcome our undergraduate members to join us at this ceremony. And so we'll be getting to them in just a moment as well. The Delta Omega Honorary Society in Public Health encourages and recognizes excellence in practice, research, education, and academic achievements in the field of public health. It was actually founded here at what was then the Johns Hopkins University School of Hygiene and Public Health, which of course we all now know as JHSPH. And it was to promote the graduate study of the field, and specifically to recognize and promote leadership in the field. We now have over 100 chapters in the society and over 20,000 members. As I said before, the three pillars are leadership, scholarship, and service. And so in the spirit of service, I would like to recognize a number of people. If everyone in the executive board of the Alpha chapter could please stand, and also anyone who has assisted us in our programmatic activities for the various committees that it takes, so please stand. These are the folks. These are the people who make it all possible. In addition, we have a number of people without whom we would not be here today, literally. And so I'd like Erica and Jimmy Lou to please step forward. I think Erica might have stepped out. So Jimmy Lou. There she is. She's hiding behind the pillar. I think it's the pillar of leadership. And then I'd also like those who serve our inductees, the family and friends who have made this possible, whose support has really promoted their ability to soar. If you could please stand as well and be recognized. Sometimes the unsung heroes, not so today. We will sing your praises. So you might wonder how you get into Delta Omega, and some of you might know because you've had to fill out some applications, but really we are looking for people who are well balanced. So we invite the top 25% on the basis of GPA to apply, but then the decisions are made on the basis of being well-rounded, particularly in leadership and service. For alumni, they have to be 5 years or greater since their last degree at Johns Hopkins, and the faculty are selected on the basis of particularly their performance in scholarship, teaching, research, and the quality of their publications. In just a moment, we will recognize all of you and also our special award winners. And I want to have a quick technical note. You will actually pick up all of your certificates outside, and it will be at the room. It's on the second floor, just over by the stairs. Before we get started with the awards, I would like to invite someone who espouses leadership to come join us and give a few words of welcome. Dean Mckenzie just began her tenure as the 11th dean last fall, and so this is her inaugural Delta Omega ceremony. I want you all to make a good impression on her. We want her to come back. She received both her master's and PhD at the school and has held faculty positions, including a Bloomberg Distinguished Professorship, and she was chair of the Department of Health Policy and Management. Speaking of scholarship, she is an expert in improving trauma care systems and policy, and she's a nationally renowned researcher and respected leader in public health. Please help me welcome Dean Mckenzie.
Well, thank you all for being here. It's an honor and a privilege to be your Dean of the School of Public Health, and it's a particular honor to be with you here today as we celebrate this incredible occasion. I want to say congratulations to all the inductees and a very warm welcome to those of you who are here to celebrate your family member, your friend, your colleague. Thank you for making the trip, especially those of you who are making it from afar. This is a big deal. Our honorees today are the best of the best. As Megan has explained, they have been selected because they have either demonstrated leadership in public health or have shown the qualities that we look for in a potential leader. And leadership in public health is more important now than ever before. We need leaders who can work across disciplines and across sectors, both within and outside the traditional boundaries of public health. We need leaders who can develop strategic, who can develop strategic alliances and think at both the systems level in tackling both the biological but also the social determinants of health. You are the future of public health. I want to wish all of you the best of luck, and especially to our new graduates. We look forward to working with you as you further your careers. And before I hand it back over to Megan Davis, I want to thank her for her leadership as president of Delta Omega. We appreciate all the time and effort she has devoted to Delta Omega, both here at the school, but also on the national level. And of course, I would like to add my thanks to the executive board who make all this happen, and to Erica and Jimmy Lou, who make everything work as it should and beyond. So thank you all very, very much. And enjoy today, and my thanks to all of you, and wish you the best of luck. Thank you.
Thank you, Dean Mckenzie. So as we get started, I want to give another little technical note. So as you come up, you will actually be crossing over to where Jimmy Lou is waving her hand, and you will get to have your photo taken with the dean, so put on your biggest smile for that. So we're going to start with recognition of the poster competition winners, and I'd like to invite my co-chair, Dr. Alden Gross, to come join and to recognize our amazing recipients. We're doing the comic relief.
I'm comic relief, yes. I want to especially thank Megan Davis, who did most of the work for us. So on a wintry February day, you can go strolling and skipping, as you should, because skipping is healthy, through rows of posters in Finestone Hall, and you can learn all about the details around cognitive aging or the effect of chromatin in nuclear cells and other fascinating things that really encapsulate what our school is doing. I'm delighted to announce the winners of our Delta Omega Poster Competition, which is an annual event to give students the opportunity to display their research and receive recognition for the work that they do. We chose the poster committee chose first, second, and third prize winners in 3 categories. Because there's so much going on, we wanted to award so many people. Policy and practice, laboratory research, laboratory research and applied research, and an overall winner whose poster is submitted and was received and was accepted for presentation at the annual APHA meeting. Some of the winners are with us today. I'd like to introduce them and invite them to receive a certificate from Dean Mckenzie. So please hold your applause until I announce all of the winners. The overall winner was Paul Nestat, who is not available to be with us. Within the applied category of research, our third place winner is Ryan Andrews. Second place winner was Sanjay Bay. And the first place winner, who is here with us today, I believe, is Jennifer Motter, who studied differences in liver waitlist mortality due to geographic disparity in organ availability. In the laboratory category, our third place winner, who is unfortunately not attending, is Justin Jacob. The second place winner is Dana Freeman. And the first place winner was Jacob Huska for defining the role of KCTD7, sounds like a Klingon battlecruiser, in epilepsy and neurodegeneration. And within the policy category, our third place winner was Andrew Patton. The second place winner was Ann McKinnon, who I believe is here. And our first place winner and the overall winner was Paul Nestat for increasing prevalence of opiates in Maryland suicides by objective testing. And I want to also acknowledge our team of judges. We had a total of 43 posters and 15 judges, and each judge was assigned as many as over a dozen posters to judge and to skip around and to review in Finestone Hall, and they did a fantastic job. So if you're a judge, please stand and be recognized. Now, Marie Diener West, Alpha Chapter board member and chair of the Master in Public Health program at the school, will. Oh, students will come. Please come up if you're here. That's important too. And now I would like to invite Dr. Marie Diener West to come present scholarship recipients.
Great. Well, thank you so much, Alden. And I am delighted to announce the winners of the Delta Omega Scholarship Competition, which is another way in which students and postdoctoral fellows are awarded and recognized for their outstanding research and scholarly activities in public health. So this year, the Scholarship Committee chose 3 winners in the areas that you heard about already. So what I'd like to do is announce each of them, have each of them come up, receive their certificate, have their photo with the dean. You're allowed to applause at that, provide applause at that time, and then we'll be done. So the first is in the category of laboratory research, and this is Nicole Camlan. And Nicole, as I read this, if you could please come up. Nicole is a postdoctoral fellow in the Department of Biochemistry and Molecular Biology. Her advisor is Dr. Janice Evans. The title of her research is Deciphering the Regulation of Mammalian Oocyte Meiosis. Her research focuses on cell cycle regulation in eggs and how accurate control is needed to form a good quality egg. So congratulations, Nicole. In the category of policy and practice, we have Ankita Meghani. So Ankita, if you could come down, thank you. And she is a PhD student in the Department of International Health. Her advisor is Dr. Sarah Bennett, and the title of her research is Unpacking the Complexities of District-Level Decision-Making for Health, How to Empower Decision-Makers to Act on Data in Uttar Pradesh, India. Her research focuses on understanding mechanisms to empower local policymakers in low and middle-income countries to use data for decision-making. Congratulations, Ankita. Of course, I'm very thrilled that she is using data for decision-making. And our third category is applied research. The winner is Shannon Wu. And Shannon is a PhD student in the Department of Health Policy and Management. Her advisor is Dr. Jonathan Weiner, and the title of her research is Post-Acute Care Utilization and Quality in Medicare Advantage. Shannon's research interests are in the care of older adults, with much of her current and future work focused on risk measurement and its impact on financing policies for programs covering the elderly. So congratulations, Shannon. So congratulations to all of the winners. I would like to acknowledge the selection committee, and if they are there here, please stand. So they include Jackie Agnew, who's sitting right there, Janice Evans, Carolyn Fowler, Shannon Frateroli, Kenny Muck, Elizabeth Platts, Joshua Sharfstein, and Carla Storr. So thank you to the selection committee. And so now I'd like to introduce Dr. Keisha Pollock, and actually it's not just Pollock, it's Pollock Porter, Dr. Keisha Pollock Porter. She is a past Alpha Chapter president and professor in the Department of Health Policy and Management, and she will present the Dr. Timothy Baker Award for International Health Development.
Good morning, everyone. Thank you for that reply. I have the honor and privilege of announcing the recipient of the Dr. Timothy Baker Award. This award was established in 2014 by the Delta Omega Alpha Chapter and honors the life of Professor Dr. Timothy Baker, a professor in the Department of International Health and longtime Alpha Chapter board member. For those of you who knew Dr. Baker, you know that he was a pioneer in disease and injury burden and was among the first to recognize the importance of injury as a cause of disability, especially in low-income countries. He was the co-founder of the Department of International Health, and in 1993, he was recognized with the Lifetime Achievement Award from the American Public Health Association. His career spanned 50 years and included work in more than 40 countries. This award recognizes a newly inducted member of the chapter who is a proponent of the poor and vulnerable and who works for the causes of social justice and international health. And this year's winner is Melissa Ruskowski. Melissa received her bachelor's degree in microbiology from Clemson University before joining the Department of International Health as a master's student in global disease epidemiology in 2010. Before returning to Hopkins to pursue her PhD, she worked on HIV-related research projects in South Africa and managed a series of military-funded orthopedic clinical trials. She's also maintained her connection to service through her active participation in SOURCE, the school's community consulting program. Her doctoral research focused on cholera surveillance and innovative vaccine-centric control strategies in Kathmandu Valley, Nepal. She hopes to continue work designing sustainable surveillance systems in research-poor settings that not only tally cases, but also improve the identification and understanding of risk factors in these areas. Once again, let's just congratulate Melissa. Thank you so much. Great. So I will turn the program back over to Megan. Thank you.
Thank you, Alden, Marie, and Keisha, for a great job, and congratulations to the recipients. This year we have a new honor that's being bestowed. This is the Alpha Chapter Lifetime Membership for Achievement in Laboratory Science. And to tell us a little bit more about it, I'd like to invite Dr. Bob Vogt to come and thank him for his generous support in making this possible. Bob.
Thanks, Megan, and thanks to you all for being here today. This is really something. I graduated from here in 1983, and I don't know what this space looked like then, but it didn't look like it does now. It was a parking lot, thank you. That happens a lot. My graduate mentor was Arthur M. Dannenberg, Jr., MD, PhD, a remarkable person. I had a wonderful conversation with him last night. He's 95, and it's still so terrific to talk with him. So knowing Art and his family over these many years, and then I think inspired by the Timothy Baker Award, we were talking one evening, Arlene and Audrey, his daughters, and Andy, his son, and we thought, we could do something of that sort, maybe a little different. Talked with Art about it, and he did not want a named award. He wanted something that would signify the impact of the award. And rather than a monetary award, which is an important thing, we thought it would be a symbolic award, if you will, such that we would cover the upfront cost of a lifetime membership, whereby the selectee would then not have to go through the cycle that I went through year after year after year of guilt when you get invited to Delta Omega things, say, oh shoot, I haven't renewed my membership. And a few years ago, I became a lifetime member and life got better. So I just want everyone to know, to think of that themselves. You get to a point in life where you can afford that. Graduating from here probably isn't there quite yet. So we thought maybe we would do it this way. So Art would prefer it to be considered, or to be entitled, if you will, the recognition for achievement in laboratory sciences. We're going to do some kind of web page thing. We've talked a little about that. All of this will get going. So that's the background. Art's family, Arlene and Audrey, could not make it today here. But they are very heavily engaged and pleased with this quite a bit. The second thing, and this is sort of a personal story, professional story, if you will, I keep track of citations, and because of this ResearchGate thing, they do it for you. All you do is look at the email. And I saw that one of the papers, the first paper that I wrote with Art when I was here, was cited in January of this year. That's 33 years ago that we published that paper, and it was in the first sentence of this January 2018 article in Toxicology and Applied Pharmacology. And it just occurred to me how much time Art and I spent arguing over a sentence. We would sometimes spend 10 or 15 minutes because we had different styles, and it would get pretty animated, and then all of a sudden it was there. We had a sentence that we really liked, and that learning experience, it's the Mark Twain thing, the older he got, the smarter his father became, and this continues to happen with me all the time with Art. I just will never be able to say enough about what he continues to teach me. And I think all of us are in that same situation coming to a school like this. The point is you get exposed to people who will teach you across your entire lifetime. And that's really what the lifetime membership is meant to signify. So thank you all very much for being here.
Thank you, Bob, for your remarkable commitment to our inductees. And our awardee, Medabelle Markway, could not be with us today, but I'd like to tell you a little bit about her. She graduated with her Master of Science in the Biochemistry and Molecular Biology department last summer, and she's currently a medical student at the Cleveland Clinic and doing dual medical and research track work. And she's also continuing the work that she began here in Dr. Barbosa's lab, looking at coupling reproductive and oncological medicine with clinical research. She eventually hopes to conduct translational research cross-nationally between West Africa and the United States. And she also volunteers weekly at the Community Health Initiative Free Clinic, where they provide free medical services and screenings to homeless men in Cleveland. And she works with MediWish International to collect and sort medical supplies from hospitals in the greater Cleveland area to send to lower-income countries. She also conducts HIV screenings in the free Minority Men's Health Fair organized by the Cleveland Clinic. Please join me in congratulating her for this honor. Hopefully Medibel's joining by webinar. We're going to wave to her. All right, so now we begin the important and amazing induction of our members. And we're going to start with induction of our graduate students. So I'm going to invite the graduate students to line up, and they're going to hand me a card that will tell me how to pronounce their names. But as I said last year, I'm really not good at this. I was a practicing veterinarian for about a decade, and Fluffy and Fido, it just does not prepare you for people's names. So I'm going to thank you in advance for your understanding. So as we come up, I'm going to have you hand me your card, and then I will read wonderful things about our incredible inductees, and you will walk across to Dean Mckenzie. So please join me in inducting Anne McKenna, Anne is pursuing a career in international health in the fields of monitoring and evaluation and program implementation. Melissa Ruskowski. Melissa is interested in continuing her work on novel approaches to surveillance and response, and will begin a postdoc studying the use of cholera vaccine in sub-Saharan Africa. Did I mention I always feel really underaccomplished as I'm reading these? Yonit Andise. Yonit plans to attend medical school and perform clinical research. Kava Anchuri. Kava was selected for a summer internship in public and patient engagement at the Patient-Centered Outcomes Research Institute in Washington, D.C. She is also applying to medical schools and has a goal to enter in 2019. She's excited to continue her world-class education in a career devoted to patient advocacy and the dismantling of oppressive structures that fuel health disparities. Shri Banerjee. One major future objective for Shri is to teach and research public mental health, especially in the areas that he has mapped for suicidology and seasonal affective disorder. Julia Bennett. Julia will be graduating with an MSPH in Global Disease Epidemiology and Control from the Department of International Health with a certificate in Vaccine Science and Policy. Mariam Biujan. Mariam envisions a future career that enables her to pursue clinical practice and research in a way that combines her interests in pediatric medicine and public health. Matthew Brown. Matthew plans to apply to medical school this year and hopes to matriculate in the fall of 2019. His goal is to become a physician to provide holistic care to his patients. He would like to thank his family and friends for supporting him in everything he does. Go family and friends. Margaret Burns Roth. Margaret plans to use her extensive experience with the Global One Health Initiative, food systems, and her passion for public health and the law by working with federal policymakers to break down the siloed systems and encompass prevention of and preparedness for disease outbreaks. She hopes to help government policymakers understand how to have new and effective ways to approach global disease with a more holistic public health view. Megan Byrne. That was an easier name for me. Megan's research interests include access to and quality of abortion care and family planning services, and community-level interventions to promote safe delivery practices. Joseph Sheed. Joseph is interested to advance urologic oncology research, promote public health awareness regarding urologic malignancies, and improve access to cancer screening programs in Lebanon. Danielle Jocasta. Danielle plans to use the policy analysis and communication skills she has gained through the MPH program in her career to support evidence-based strategies for family planning and reproductive health. You do. So you can afford the lifetime membership. He will join Eli Lilly and Company upon his graduation as a research scientist. I'm kidding. Where he will continue to work on studies of clinical trials and make efforts to move beneficial molecules to regulatory approval faster and thus benefit public health in a timely manner. Congratulations, you. Erin Evie. Erin is interested in performance improvement and innovation in health systems to increase access and improve organizational effectiveness. Rachel Favey. Rachel will be joining the faculty at SUNY Upstate Medical University in Syracuse, New York, as an assistant professor of public health and preventative medicine with a joint appointment to the Center for Bioethics and Humanities. William Garrett. Upon completion of medical school, William intends to pursue a career as a psychiatrist and public health practitioner that uses community-based participatory research and programming to ameliorate disparities in mental health care. Leah Ann Goldberg. Leah will attend medical school this fall at Temple University's Lewis Katz School of Medicine, where she hopes to integrate her interests in public health and clinical medicine with an emphasis on pediatric and adolescent health. Victoria Green. Victoria's research interests focus on behavioral health policy and services. Specifically, she is interested in the effects of national and state policy initiatives on insurance coverage, utilization of services, and health outcomes among those with behavioral health conditions. Anahasha called Klunder. Let me try that again. Klunder. Anna currently researches the pathogenesis of bacterial vaginosis at the Hopkins Center for Nanomedicine, and next year will continue this research as a Fulbright scholar in Germany. Marissa Hast. Marisa will join the Epidemic Intelligence Service class of 2018 in the Division of Parasitic Disease and Malaria at the U.S. Centers for Disease Control and Prevention. Gabriele Hedrick. Following completion of her degree in third term, Gabby began work as a public health nutritionist in Cambridge, Massachusetts at the local health department. Ground line, yay. Her research interests focus on leveraging federal nutrition assistance benefits for improved health. Maria Ibrahim. Maria is completing her PhD research at the University of Maryland and will be developing novel dental sealants. She has been doing this simultaneously with her MPH studies, and she aims to return to Saudi Arabia to work at Imam Abdulrahman bin Faisal University, where she will teach and continue her research in the field of caries prevention. She will also work on behavior change programs that target the prevention of sports-related traumatic dental injuries. Very important work. Rachel Gore. Rachel currently works as a clinical genetic counselor at the University of Maryland School of Medicine, where she helps pediatric and adult patients understand their diagnosis or risk with regards to a genetic condition. Deborah Odihi. Deborah's current research interest is in the use of contingent valuation and other stated preference methods to improve the procurement of vaccines in lower middle income countries. She is very interested in the improvement of maternal, child, and neonatal health and learning more about sustainable ways to improve their health, especially in LMICs. Oshin Kanhur. Kamwur. Oshin's research interests lie in surgical outcomes research and health disparities research. As a public health professional, Oshin intends to examine the sources and effects of inequities in medical care in order to develop evidence-based strategies to tackle them. I love that so many people are doing disparities work. Ken Kiriyama. Ken is a rising fourth-year medical student at UCLA, and during the upcoming academic year, he plans to apply for residency training programs in ophthalmology. He also plans to work on research projects that examine disparities in eye care, in addition to continuing to assess low-cost screening modalities for glaucoma in under-resourced settings. Aparna Krishnan. Aparna is pursuing a career in community-based primary health care as a family physician and public health researcher. Sylvie Lawson. Sylvie will be pursuing a career in midwifery and as a women's health nurse practitioner in the Bay Area with the mission to mitigate maternal health disparities in the United States. Joy Lee. Joy has engaged in research and advocacy efforts to reduce high drug prices while at Bloomberg. She is returning for her final year of medical school in July. Sarah Lipstein. I'm sorry, she goes by Kate. Kate plans to dedicate her career to improve the U.S. food system. That's a big goal. She hopes to influence agriculture and food system policy in order to increase the availability and affordability of healthy food while ensuring environmental sustainability. Afrin Mahmood. Afrin is passionate about addressing the health needs of displaced persons resettling in the United States and will be applying to medical school in hopes to supplement her public health background with clinical knowledge to best serve this important population.
That's a pretty tough name.
I can do it. Vasunthakumar Namasivayum. As an Indian Administrative Service Officer, Vasuntakamar would be implementing evidence-based public health programs and policies in places with large health needs. He will be joining University of Manitoba, Canada to work as Executive Director of Uttar Pradesh Technical Support Unit, and he'll be formulating health policies for the betterment of poor people in India. He believes that the knowledge he has gained at Johns Hopkins Bloomberg School of Public Health will help him in this endeavor. Nobotosi Nawa. After graduation, he will return to his university in Japan, where a new MPH program has been launched. And as a faculty member, he plans to conduct formative research to promote vaccination and train future leaders to be compassionate public health practitioners. Milanare. I'm sorry, Neira. Mila will be returning to the Institute for Family Health in New York City, where she will continue to work in obesity prevention and food security interventions. Thamumna Nisath. Thamumna plans to attend medical school this fall and eventually combine her interests in health systems improvement and cardiology to care for the underserved in the US and abroad. Sarah Jane Khan. Sarah Jane will apply to medical school this summer and continue to pursue research related to neonatal brain injury. Lauren Parmley. While at Johns Hopkins, Lauren's research explored the integration of HIV in sexual and reproductive health and rights services for female sex workers, as well as barriers to ART coverage for sex workers living with HIV. Currently, Lauren works on the analytics team for the population-based HIV Impact Assessments project led by ICAP at Columbia University. Walter Peoples. Walter is a captain in the United States Army. Upon graduation, he will move to Fort Carlson, Colorado for his next assignment. He plans to practice industrial hygiene and will continue to work on improving rapid field evaluation of occupational and environmental hazards for forward deployed troops. Rachel Pellegrino. Rachel has been participating in research focused on infectious diseases and health equity, and next year will be completing her last year of medical school with the hopes to continue to work at the intersection of the two disciplines. Tanvi Poluri. Tanvi works to understand sex differences in immune response to vaccines. She aims to continue as a research scientist in public health immunology and infectious diseases. MD Sohirana. MD will be focusing on working to reduce maternal and child health mortality in developing countries. Using his public health knowledge, skills, and experience, he wants to make the world safer for every single mother and her growing child. Ashna Rao. Ashna will be attending medical school in the fall while also continuing to develop her software application Bainbridge, a technology intended for the early detection of mental health disorders. Anne Rosenthal. Anne plans to work on programs that promote more equitable access to healthful foods using urban food policy as a platform for social justice. Sandy Salivaras. Sandy is currently a researcher with the Washington State Department of Health in their Office of Nutrition Services. Sandy uses her skills in spatial analysis to better characterize her state's women, infant, and child nutrition program participants, to identify pockets of need, and to identify demographic patterns that potentially drive statewide decline in WIC participation. Ahmed Shakarchi. Ahmed is interested to uplift health in vulnerable populations and advance clinical and public health ophthalmology research. Soyun Sim. In the future, Soyun hopes to continue contributing to vaccine policies and economics, as well as innovative financing mechanisms that target multi-sectoral interventions for global development. Daye Song. Daye hopes to pursue a career as a clinical neuropsychologist by protecting and improving the physical and mental well-being of children with neurodiversity. Salma Sparklin. After graduation, Salma plans to stay in the area and continue her career to bridge the gap between research and practice through her talents in writing and communications, qualitative data analysis, strategic planning, and team leadership. Elizabeth Stone. After graduation, Elizabeth will continue to work at Hopkins as a senior research program coordinator, focusing on research related to policies and programs for individuals with serious mental illness and substance use disorders. Christopher Solmanti, Jr. As project administrator to the Johns Hopkins Biocontainment Unit, and in partnership with the Maryland Department of Health, Christopher will be co-leading an initiative to develop a statewide training network among hospitals aimed to strengthen preparedness for events involving high-consequence pathogens, which is great because of the new Ebola outbreak, so thank you. Catherine Simmerton. Katherine will be working on muscular dystrophy clinical trials at Kennedy Krieger Institute and hopes to attend medical school to continue to work on promotion of child health. We now get a twofer. Tamwajia. During her time at Johns Hopkins, Wajia pursued her dream to start an international nonprofit social venture that aims to empower underserved women and children through her 4 picture books. Named Kitesong Global, she hopes to lead it full-time and serve in low-income countries with her family. Amelia Thurber. Amelia is a current medical student at the Johns Hopkins Medical School and is a future internal medicine physician who aims to improve care delivery for patients with chronic conditions. Shreya Tulsiani. Shreya will be starting a career in health communications, focusing on women's reproductive health, and will begin medical school in 2019. Rebecca Twombly. Rebecca plans to pursue a career in monitoring and evaluation of health interventions in humanitarian settings, and to improve accountability systems for global health aid. Judith Beck. Judith aspires to become an academic physician researcher. As a health systems researcher, she is interested in the ways that psychological and social factors constrain healthcare delivery in the U.S., and how these features can be intervened upon to design more patient and family-centered systems. Katherine Walsh. Katherine plans to use her research and policy knowledge to advocate for programs and policies to improve women's and children's health in disadvantaged communities. Anchi Wong. After graduation, Anchi will pursue a PhD degree in epidemiology at the University of Southern California and will continue her research in prostate cancer. So apparently she's a glutton for punishment. Bethany Orion. Bethany will be pursuing her interests in both epidemiology and global health, working at a global development strategy firm in Washington, D.C. Halit Onur Yapisi. Halit will use his clinical background combined with his quantitative analysis and business skills to make a positive impact in the healthcare industry. Halit also will continue building research skills in comparative effectiveness and patient-centered outcomes. Emily Young. After graduation, Emily will pursue nutrition policy research in Philadelphia, looking at food systems and obesity prevention. A big round of applause to all of our graduate inductees. We are now delighted to welcome for the first time participating in our ceremony, although we've been inducting them for a number of years now. Maria, do you remember how many? Five-ish, yeah. But for the first time, we have had them join us here today in an effort to help bridge our big family of Delta Omega and to let them get to know all of the graduates and for the graduates to get to know this up-and-coming new crop of public health practitioners. Please join me in inducting Lauren Alpert. Jennifer Offel. Victoria Chen. Amy Hong. Caroline Liu. Ivory Hong Lo. Zaim Lone. Upor Hirsch Shakir.
This is a graduate student who got
More comic relief. We have one out of order, so we're going to skip back to the graduates for a moment. Albert Jaeon Liu. Dr. Liu is a physician from Taiwan with a special interest in public health and higher education. He's been an exceptionally brilliant student in the MPH program and was always willing to help out other fellow students. His career goal is to become an academic behavioral neurologist to tackle the dementia epidemic in our aging society. And Tierra Burrell. Tierra will be working at Kaiser Permanente as a pediatrician, and while at Hopkins, she worked to evaluate psychological factors related to firearm safety. Did we miss anyone? Great. Please join me in congratulating both of our graduate and especially our undergraduate members. No induction would be complete without some words of advice. And so historically what we do is we invite our faculty and alumni inductees to pass along some pearls of wisdom to you. So I'm going to call each of them up and say a little bit about them and then turn the podium over and let them tell you what pearl they would like to share. So please join me in welcoming to Alpha Chapter, Dr. George Demopolis. Dr. Demopolis is professor in the Department of Molecular Microbiology and Immunology and the Malaria Research Institute. He received his PhD from the University of Crete, pursued postdoctoral training at the European Molecular Biology Laboratory, and his first faculty appointment was at the Imperial College London before joining Johns Hopkins University in 2003. His research, which is really interesting, focuses on the biology of mosquito pathogen interactions, and his long-term goal is to develop novel intervention strategies for malaria and dengue. George, congrats.
Thank you. It's really an honor to be elected into the society. When I was a graduate student in the early 90s, almost everyone in the lab where I was doing my graduate research wanted to become a faculty, wanted to pursue an academic research career. And most of us made it. Today, unfortunately, that situation is not the same. And I notice that a large proportion of our students, they do not consider that career track anymore. And that's because they listen to people like me and my colleagues complaining about how tough it has become. The funding in particular. And words of advice and wisdom, don't listen to us. Okay? You should pursue your dream. If you like the idea of being paid for doing your hobby, the freedom of working on what you like most and what you find the most interesting. If you like the idea of being surrounded by brilliant people at your workplace, the academic career track is for you. And don't worry about the rest. You've already proven to be very competitive. Thank you.
I'd like to welcome Dr. Murray Hardwick. Dr. Hardwick is the David Bodian Endowed Professor of Molecular Microbiology and Immunology. Her lab has uncovered molecular and cellular mechanisms of cell death, mechanisms by which cancer cells fail to die and by which neurons die prematurely in disease states due to gene dysfunction or genetic mutations. The long-term goal of her research is to understand and ameliorate disease by protecting irreplaceable cells or eliminating dangerous cells. She has published many papers and has been a speaker at major scientific venues and continues to be an active participant in education. I also happen to know she's a very good mentor to her students. So, Marie, congratulations.
Thank you for this honor. Better late than never, in my case. I want to congratulate all of you. You are empowered now to go and do wonderful things, both small and great. And the longer you go in your career, the more empowered you will be. And I think inspired in part by one of my PhD students who's here being honored today, I thought there might be one thing you might not have thought of to do yet, and that is to try and remember what it was like when you felt like an unempowered student. And that gets more and more challenging as we proceed in our careers, but I think so important. Good luck to all of you.
So Dr. Smisha Agarwal cannot be with us today, but I wanted to recognize the induction. Dr. Maureen Kadorit has been a mentor of mine for many years. She's currently assistant scientist in the Department of Environmental Health and Engineering, so very close. Our offices are about, half a block around from each other. She's also the director of the Occupational and Environmental Health Nursing Program, which is part of the National Institutes of Occupational Safety and Health Education and Research Center. So Maureen, congratulations.
Good morning, and thank you for the honor. I have two little pieces of advice for you. Number one, when you go out into your career, find a good mentor, someone who believes in you and someone who will help you through the course of your career. I was lucky enough to have two of them, and they helped me get where I am today. The other thing is, about 15 years ago, I had a very serious health incident. And I came upon a refrigerator magnet that I still look at today. And it's a quote from Winston Churchill. "When you're going through hell, keep going."
I'd like to welcome Dr. Jillian Fry. Dr. Fry is a project director at the Johns Hopkins Center for a Livable Future and an assistant scientist in the Environmental Health and Engineering Department. She works on food animal production with a focus on aquaculture and has a new course in aquaculture that she launched just a number of years ago. So welcome, Jillian. Congratulations.
Thank you so much for this honor. It's quite a tall order to offer some words of wisdom to this group, especially after hearing the descriptions of the work that you do, but nonetheless, I will proceed. I like to watch the show 60 Minutes. Is anyone else in here a fan of 60 Minutes? I'm turning into my father, apparently. I like watching the show, but I also get very frustrated at hearing about decisions that are made that make no sense, especially in the context of public health, or a lack of oversight to different industries. And my encouragement, it's not really a word of wisdom, but it's an ask that we join our voices and raise our voices in support of issues that will solve for pattern. So we oftentimes are up against very strong opposing forces when we're trying to promote public health and translate our research into policies and programs. And if we raise our voices in support of things like reducing the role of money in our political system, imagine how that would help our food system, gun policy, and other really important issues that right now we feel like we really can't make much headway. So it's not really a word of wisdom, but it's words of encouragement that we take care of ourselves and celebrate small successes, because we're really up against very strong forces, but there are other ways that we can make progress together if we take some time to dedicate efforts to solving for pattern and not just the specific issues we work on. Thank you so much. Please join me to welcome Dr. Rachel Gore. Oh.
Incorrectly.
Oh, gotcha.
I don't know.
That's okay.
So thank you.
Anyway, Rachel currently works as a clinical genetic counselor at the University of Maryland School of Medicine, where she helps pediatric and adult patients to understand their diagnosis or risk for a genetic condition. All right, please join me to welcome all of the faculty and alumni inductees. A system is a set of interconnected parts that forms a complex whole. And this year I've been reading some of the works of Donella Meadows. Dr. Meadows wrote Thinking in Systems, and maybe a little bit more famously, the book Limits to Growth. And she said that purposes of the system are deduced from the behavior, not from the rhetoric or stated goals. And I think that what you've seen here today is that Delta Omega is more than just a National Honor Society. It is a system that fosters leadership, scholarship, and service. And it does so through the relationships of all of the parts. Each of you is a gem. Each of you is doing amazing things and is an incredible person. But it is your relationships with each other that will allow you to be able to foster leadership, scholarship, and service in public health. And so I implore you to build those relationships, to get to know your fellow inductees today, to reach out, and the alumni and others who are joining us by webinar, reach out also. Stay connected with us, and stay connected with the remarkable students we educate here at the School of Public Health. In some ways, Delta Omega is for this elite group with remarkable potential, but it is also for everyone who works in public health, or for everyone who is benefited by the service we give. This is the moment where I finish my term as president of the chapter, and I would like to thank everyone who has worked so hard to make this all possible. Welcome, Dean Mckenzie. Thank you, Alpha Chapter Board, particularly our newest members, Dr. Alden Gross and Dr. Sally Ann Iverson. Thank you to all of the inductees today for being such inspirations to all of us. I'd like to welcome Dr. Gundala Bosch. She directs the R3 Center for Innovation in Science Education. She got her PhD from the Max Planck Institute in biochemistry. She has multiple master's degrees, but one, which I think is very important, in education in the health professions from Johns Hopkins School of Education. And she is your new president. Welcome, Gundala.
Thank you.
Okay, so I couldn't find anything in the Delta Omega colors, salmon pink for public health, and of course our blue for the Johns Hopkins Bloomberg School of Public Health, but here we are.
Thank you so much. Thank you.
And I'd like the whole board to come up. If the whole board could come up, yes. Because I want to emphasize that this is a team effort. And that it is our relationships that will make us strong. So thanks to all of you, and we will have, on behalf of the entire board, welcome to Delta Omega, and we will have a reception in Finestone Hall. Don't forget that for those of you who need certificates, that those are waiting for you at the top of the stairway on the second floor. Thanks.